Hello, Diaz here, founder owner Greenwood Dental. Welcome back to another video. Today we're talking about partials, which are the fake teeth. It's a very tough conversation to have with patients because number one, I have to break the news to them that their teeth are not salvageable. And I am the type of person that I like to fix things and I like to mend things and I like to heal things. So for me to come to the conclusion that really, is this all we can do? Have we exhausted all possibility for us to save the tooth? And when the answer is no, and I really try really hard to find a solution or find a way to save the tooth. So the tough part is to break the news to the patient, let them know that unfortunately there's nothing I can do to save the tooth and you have to lose it. And you can refer to my previous video that I spoke about extractions or pulling the teeth and why do we recommend extraction and how do we get to that point. Now, pulling the teeth out and replacing them with partials or fake teeth or false teeth, it's super easy. The problem is with partial is the emotional readiness to wear fake teeth. A lot of us will associate that concept with age. This is it, this is the end, I'm gonna look like my grandmother, I'm gonna look like my dad or my mom or anybody that's in your family that had dentures and they're suffering, they can't eat, they can't smile, they're embarrassed. It affects your confidence, it affects your speech. So the process of extracting the teeth and replacing them with denture is not hard, it's really easy. Literally it takes within maybe 6 weeks, with 6 steps, 1 step every single week. By the end of 6 weeks, you're going to end up with teeth. But the challenge is, and the frustration is, the emotional readiness to wear the dentures and to get used to talking, eating, swallowing, and smiling with fake teeth, which they're not yours. Now, the technology has evolved so much and advanced so much that they are absolutely beautiful appliances and they look very natural, and we are having more and more technicians going to lengthy amount of classes and schooling in order to deliver a very natural looking but also very functional appliance as removable dentures. Dentures can be full arch, meaning that unfortunately with some patient that has to lose everything due to periodontal disease, and please refer to my perio video so you can connect the two concepts together. Periodontal disease does not discriminate. It can attack and destroy mouths as young as 35 years old, 30 years old. I've seen it at 27, I've seen it at 15 with patients that are wearing partial dentures. So periodontal disease or gum disease that causes the tooth loss does not discriminate, and it is very aggressive disease if it's not controlled by treatment. So going back to dentures, again, it's so easy to make dentures. It's so easy just to pull everything and replace them with a partial denture or full denture. Like I said, the full denture will replace the full arch of teeth. Partial dentures, if you are partially missing teeth in the arch. So if you're missing the front and the back, or you're missing the back and the front, or you're missing, one side over the other side, because unfortunately we could not save any of these teeth. Wearing dentures needs practice. Wearing dentures needs a lot of emotional support and a lot of emotional encouragement for the patient, and also to be very patient. You need a lot of adjustments. You're going to learn how to talk, like I said, how to swallow, how to chew. So it's a very high learning curve in some of us, especially when we get to the point that we are dealing with seniors, that their motor dexterity is not quite there. They have a hard time putting them in, taking them out, cleaning them, and caring for them. And that can get very frustrating and discouraging. So all I can tell you as far as dentures, make sure that, number one, and I mentioned it in the previous videos many times, that preventative is your best friend. Trying to prevent tooth loss so you don't end up in a situation that you have to choose what you're going to wear and how you're going to adjust to the new lifestyle as far as teeth are concerned. But it is it is challenging, and at least the way I practice, I try really, really hard to exhaust all possibility in order to save the tooth, so you guys are not venturing, or you're not moving into the phase of wearing dentures. I have patients though coming in the office and they say, just pull them out, I want dentures, but they don't realize what they're getting themselves into. And that's when I spend a lot of time discussing and talking and just saying, please, I beg you, try to fix it. You don't want to wear dentures. Now, if you have to, that's definitely an option. Again, refer to my other videos, and I talk about that a lot. That's it for today. DS out, and I'm wishing you a very happy dental health.